I just want everyone to know that medication harm is happening every day at hospitals and other medical facilities. Because of my job, I hear all kinds of horror stories firsthand from patients and their families. But here's one common example. A fairly healthy elderly person experienced a minor health incident, like a fall with a minor fracture, and goes to the ER. The hospital admits the elderly and runs some tests. They also give the patient various medications. And before long, the patient develops serious delirium or even psychosis. A side note, to ensure their profitability, the US hospitals won't give the exact same medications as the patients take at home. They give similar formulary drugs instead, which create confusion and also increases risks. The tragic part is that oftentimes elderly patients never go back to the prior functioning level once the damage is done to their fragile brains. Unfortunately, I witness this regularly. But there's something we can do to reduce medication harm and unnecessary suffering. Here are my best simple tips. Number one, the truth is the patient engagement is a great start to reduce harm. Know your own medications, not just the names, but doses and what they do to you. Number two, be and use a care partner or an advocate, a family or friend who pays attention to the care the patient receives and advocate for them. Do not let anyone go to the ER or stay in a hospital by themselves, especially the elderly. A care partner needs to know all the medications the patient is supposed to receive and verify them as they are given. If the patient is elderly, be sure to confirm with the nurse that medications aren't on the BS list, which is a well-respected list of potentially harmful drugs for older adults. Finally, have a team player attitude with the nurses and other clinicians. Understand they are often given an impossible amount of work in an imperfect clinical environment. Be an extra set of eyes and ears for them and ask concise questions if you feel something may be off with the patient. If these responsibilities sound too daunting to you, you can also reach out to professional independent patient advocates and learn the skills with them before something happens to you or your loved one. Let's reduce medication harm together.